how young is too young for a facelift?
Yeah, I don't think you can put an age on a facelift in any way, shape, or form. I think when you look at the major cities such as yours, Beverly Hills, people are having facelifts very young. I think the results you get on younger patients are probably much better and last a lot longer. So I think if you're a true candidate and you have jowling and some excess neck tissue, and you want to get a nice long lasting result, and by long lasting I mean 10 years, and yes, there's always going to be maybe a minor amount of relapse, but the younger you are, there's just more collagen in your skin, the tissues hold up better, the tissue planes are better defined, everything looks more natural honestly when you do it, because there's more thickness of subcutaneous tissue to hide the deeper work. I don't think there's an age limit by any means. I'm not telling you I'm going to go do a facelift on a, I actually had a friend of ours asked us to do a facelift. She's like 30, I think she's 33 or 4 or something. And I just didn't think she was a candidate. We did some non-invasive stuff, but maybe in 40, yeah, no question. But again, I don't think it's age. I think it's just how your face ages.
First thing you said was jowling, and I agree with you. That's actually like one of the primary indicators for me of when someone is sort of ready for a facelift. I guess the reason I brought up this whole kind of question is because I've seen somewhat recently, to me it's alarming that there are like 30-year-olds coming in asking for a facelift.
Yeah.
And these aren't people with jowling. I mean,
Yeah.
these are like beautiful cervical mental angles,
Yeah.
no jowls. They have no marionette lines. They have maybe some slightly pronounced, nasolabial folds. And it's mainly for that reason that they're saying that, oh, I want a facelift because I really want to bring things, back to where they were, where they never were. They always had those lines, they tell me sometimes. And I've seen them operated by some of the local surgeons. To me, it's a little concerning. I don't know if I completely condone that. On the other hand, there are other advanced procedures on the face that we do on younger patients, so maybe why not that? So I think it's not so much maybe a complete facelift neck lift. We're really talking about kind of like a mid facelift in these folks.
Yeah.
But I haven't pulled the trigger on any of them. I've kind of sent them away for, or offered non-surgical. But yeah, but it's being done by some big names, and I don't know. I'm not sure I feel great about that.
My concern always is after I got out of my fellowship, I started doing deep plane facelifts, right? I don't know if I'd be comfortable doing a deep plane facelift on someone who's already had a facelift because the anatomy is all altered. That would make me not choose that. So I think the other thing you got to look at is when you go do a revision, you can read someone else's op note, but you don't really know what was done. You don't know where the entry point was. Let's say if they did a deep plane facelift, exactly where it was. I mean, maybe you can see from sutures, they put non-dissolving sutures, but I think you're limiting your options as you go out. And revisional surgery, as you know, never looks as good as the initial surgery. So I think you're burning a bridge later, especially if you don't
That's a
really.
really good point. That's a really good point, actually. I hadn't actually thought about this, but as we, as a community, start to do more and more deep plane, the revisions are going to be more challenging.
Yeah.
And I know people who do a ton of deep plane, and they've changed their suture material even that they use on the SMAS to make it more permanent, because this way they can find the stitch if they were to go back into the faces that they've operated on themselves. But now take someone else's case, and you're trying to figure it out, and it can get a little bit hairy. So I agree with you. That's something that I don't think has ever really been a major issue sort of globally, because for a long time people were just still doing the little
Yeah.
skin excisions and
Yeah.
maybe just some superficial SMAS tightening. But as more and more people adopt a deep plane approach, because it does create more substantial changes, we'll have to then consider what we do for revision cases, and it definitely is a trickier situation.
Yeah, I agree. And also noting on that patient who comes in and maybe they have a baby amount of jowling, that's where I think some of these non-invasive treatments actually can come in, because you can target just the jowl, take the jowl down a little bit, tighten it a little bit. If it's 30%, great. And then you can camouflage a little bit behind and an anterior to it with a little filler. And it's gone.
Totally.
And it's totally gone. And I've done that with younger patients, and they've been very happy. And sometimes those are the people who come in and said, I need a facelift, and there's just like barely anything there. So they have less downtime, and then they didn't, they still have the opportunity in 5 or 10 years to do the facelift.
Yeah, no, I agree. I like that approach much more. And so, again, it's always tempting because people are excited about surgery. I've had people, get really upset because they're like, I've saved up for this procedure, and they're literally like, 30, 31.
Yeah.
And I'm like, yeah, but I don't think you need it, you know,
Yeah.
and it's just, it can be a tough conversation, but an important one.